what is coming. And I was talking about this with my brother, and he had kind of a great way to think about this legislation. Essentially, President Obama laid out this $2.5 trillion business plan over 10 years. And he was going to finance this $2.5 trillion plan by getting young, healthy individuals to, out of pure altruism, bump the cost of their insurance 350, 400% to cover these people. Now, as a business model, trying to make it sustainable simply by hoping people jump into the system is probably not going to work. No private businessman would ever take that model. So then they tried to say, well, let's push them in with an individual mandate. But there's a loophole in the law. It's so big you can drive an aircraft carrier through it. Turns out there is no individual mandate. There's not even a tax. Turns out the IRS doesn't have the legal ability to go collect that money unless you, quote, overpay on your tax withholdings and get a return at the end of the year. They don't have to send you all your money back. They can hold that. But if you learn how to adjust your withholdings, so at the end of the year you have to write a check to Washington, there's no legal authority for them to come after you. You're safe. So as soon as the American public learns how to structure their tax withholdings, there's no penalty. There's no tax. So there's no individual mandate. So what's going to happen? The young and the healthy are going to stay out of the market because there's this no pre-existing condition clause. They know if they get sick, they can hop in, but there's really no reason for them to go pay 200, 300, 400% of what they were getting to buy insurance that they're not going to use. So the young and healthy are going to sit on the side, which is going to put enormous pressure on the insurance industry. And they're threatening bankruptcy at that point. So what's happening to shift towards a single-payer system, which is really the agenda of the left, is to expand or keep Medicare, get states to expand Medicaid, and cost shift to the private insurer. Now what happens with the expansion of Medicaid? I was testifying up in Ohio, and I wrote a paper for them called The Final Days of Federalism. And I'll get it to Ellen so she can make it available on a PDF. But the basic idea behind the expansion of Medicaid, the reason why I argue so strongly against it, is long term they're playing chess while we're playing checkers. What they're going to do, President Obama's going to do with Medicaid, is convince states by handing out all these billions of dollars to get states to expand program to pull in all this federal money. Every state wants federal money because they want to balance their books. So once states have expanded their Medicaid program, all the feds have to do is cut back the federal percentage. It's something called the FMAP, Federal Matching Assistance Percentage. It's the amount of federal money that Washington sends to the states for their expanded Medicaid program. All they have to do is pull back on that number, which they can anytime they want, and they've actually said they will, which leaves the states in a place with this bloated Medicaid program, lack of federal dollars coming in, so the states cannot support themselves. The only escape for states at that point is to offload Medicaid from a joint state-federal program, is to hand it to the Fed, so it becomes a federal program. Then the state or the feds have Medicare, the state or feds have Medicaid. They've cost shifted, putting the private insurer out of business, and you're driven to a single-payer system. That's really where they want to go. That's part of the reason that we cannot expand these Medicaid programs. Then we have to find some alternatives, but that's the biggest reason we can't. The reason I called my paper The Final Days of Federalism was the way Washington got states to buy into this. Even though it's going to destroy state budgets by expanding Medicaid, why are they doing it? Governor Kasich. Well, there's something called DSH payments, disproportionate service hospital payments. That is about a $12 billion federal program that's run through states that gets extra money to hospitals taking care of uninsured patients. President Obama was going to cut that by 75%. Hospitals knew that they would go bankrupt without these DSH payments. So President Obama pulls money back with the left hand and then offers it back with the right, saying now all you have to do is expand Medicaid and you can get your money back. That is a fundamental breakdown of our federalist system of governments. You think about what's really happening. The states are paying money. We, the people, are paying money to the feds. He offers it back with dish payments. He threatens to withhold the dish payments, knowing that to put hospitals into bankruptcy, offers it back with this hand to get states to move to a position that they don't want to go in order to set up a single-payer system.